We had over 800 delegates, right?
890 delegates total, 650 in attendance.
Yeah. And Jay had a previous international consensus on infection that was done 5 years previously. But he worked it took him 2 years to get this whole group together. And it really was an amazing group. Number one, these were people that they weren't just orthopedic surgeons. Why don't you tell everybody that was there outside of orthopedics?
So we had obviously infectious disease specialists, microbiologists, veterinary surgeons, rheumatologists, hematologists, anesthesiologists, and numerous other disciplines. Because as you know, John, and during the meeting, some questions related to their particular subspecialty.
Yeah.
Because during the meeting, some questions related to their subspecialty. And we also had representative from FDA, NIH, and CMS and other payers as well that were there.
And industry too.
And industry.
So it really was. It really encompassed all the stakeholders in what we're dealing with today in periprosthetic infection. It wasn't just hip and knee either. There was shoulder and spine and other areas, but we're going to concentrate talking on the hip and knee, and that's where AUKUS became involved in this. So what we did 5 years ago, the OREF, Orthopedic Research Education Foundation, supported the publication. And this year, AUKUS and OREF, from grants from the two organizations, are the ones who supported getting the actual document together from the hip and knee standpoint and the general standpoint. And we'll get into that here in a minute. But the Delphi consensus, you want to just talk a little bit about that just for a
Sure.
minute for people to understand how thorough it is?
Sure. The detail of how this was conducted is in the Journal of Arthroplasty publication. But briefly, as John says, it was a Delphi consensus process, which includes multiple steps, including selection of the delegates in the first place. How do you decide on who should be coming to the meeting, who should be contributing, what the questions are, how should the questions be formulated? Ask the question one way, may get another answer than the other. Then review of the literature in a systematic fashion to make sure that no stone is unturned and all of these literature and publications are reviewed and summarized. And then there's, of course, the whole process of writing the documents, editing them, then the face-to-face meeting where we go through them the day before, make any final adjustments in the recommendations or the questions themselves. Then there is the fun part of voting, as you recall, and sometimes very passionate discussions were conducted, and some of these, everybody who had the passion, they just basically wanted to do what's right for the patients. And of course, it's called consensus because not everybody's going to agree on one question.
So that's the most fun thing. Now, we should take a poll. You watching this, and you figure out how many questions we had. How many questions do we have total?
Total of 652 questions.
652 questions. How many times did we have 100% consensus? Was there one?
No, there was. Hip and knee, we had a few. But the other disciplines, interestingly, there's many questions where they had 100% consensus. But I would say maybe 10 to 15% of questions where you reach what we call unanimous. But majority of the time they were strong or very strong. And only very few out of that 600 odd questions did not pass consensus.
But there, a lot of times it would be 80-20. What's considered very strong, to just give an idea?
Anything above 75% was considered very strong.
That's how we are as orthopedic surgeons, in that we're never going to agree with everything. And that's what the whole purpose of this Delphi process is to get to a certain percentage to say that we can at least agree that in general, we can agree on this to some point. It's not that saying that 100% of people agree on this. I think that's the real important thing, is people read these documents, that they understand that there were people who disagreed, but we actually put those votes down there.
Yep.
The other thing to show you how seriously Jay and Thorson and the moderator took this is it took us 20 minutes to make sure that the counts, we did this all on electronic counting, to make sure that the counts were coming through and that people were doing what they're supposed to do. This, you'd find it hard to believe, but I found that very interesting. I participated in the last one, but I had forgotten. But you have to really be very careful. Otherwise, you have garbage in, garbage out. And
Absolutely.
Jay, I give you guys unbelievable credit. The other thing you have to realize, especially in this day and age, the beauty of this system is now people were able to online send poor Jay all these emails and to bring up the discussions and that. And I think it was even a better process than 5 years ago. Yet there's about, gosh, the amount of data that we went through probably was 5 times what it was because we've learned so much more about it.
Yeah,
Correct?
that's true. And there were more issues to discuss in this time. There was obviously the social media, and also during the face-to-face meeting, we had the ability to receive these emails, implement the suggestions. But as you saw the process, John, it was a very engaged process. Everybody was there. They really knew exactly why this issue and this mission was important. They contributed immensely to this whole process. And the publication that's out in Journal of Arthroplasty, and thanks to Journal of Arthroplasty and to John for making that available to our membership, I strongly, strongly advise that you access those, read them. They will make a difference to your practice. They have already made a difference in my practice. And in this situation, in this circumstance, when we don't have evidence behind everything we do in orthopedics, consensus is as good in getting us to providing the best patient care we can at this point.
And you can go right on your smartphone today. You can go right up against the reader and get it downloaded there. You can see the entire 57 questions with the editorial. They're all there, and they will be coming out within the next month or so in print volume. But you have it all online for yourself now. The other thing I find that's very interesting about this, and I told this to Jay, and I think in the publications, those of us who helped him with the editing really wanted the references are all the up-to-date references that anybody, if they're trying to look up any area on infection, can go to one of these questions and they can get a reference search right there for seeing what areas they want to study or what areas to look at to try to help. And I've already sent people to that in the last 2 days, especially young investigators or anybody interested in it. Or if you're just seeing a patient and you want to know about a specific problem, you go to that question, you could go and see some of these things only have 1 or 2 references in the literature, but I guarantee you they will be in that document, Jay, and you deserve all the credit for that.
I mean, John, you were involved in the last 2 or 3 months, how much your work has gone into actually, even the final edits required numerous hours of reading every single line to make sure that no error was made. We hope that there are not many errors. With a document of this volume and this size, naturally there are going to be some errors. We hope you'll forgive us for those, but we've tried to do our best to try to create a document that will serve us on a daily basis in our clinical practice and providing good care for our patients.
The only other thing I'd like to say is if you see Jay around this week, really go up and give him a good kudo, because this was really a monumental task. His passion for infection has been there. All of you know he's written probably over 100 articles on infection, but this is really selfless work, and we appreciate yours and Thorson's and everybody's involvement. And orthopedics appreciates it. I know AUKUS appreciates it. OREF appreciates it. That's why we wanted to put our money toward this. We think it's a high value to those who are practicing in arthroplasty, dealing with a really difficult problem of infection, which we still haven't gotten to the bottom line on. So thanks a lot for that.
Thank you. Thorsten and I would like to thank the leadership of AUKUS, OREF, in particular Dr. John Callaghan, for their generous support of providing a grant that would allow us to publish the material and make it available free of charge. And thank you for your friendship as well. Thank you.